weren't just watching me.
Watching us all like.
Alright, so I'm here with Liz, Chris, one of our RNs, Laura, our other RN.
Hello.
And Shirley, who makes it possible for us to private label our products. We have 5 products that we private label that we love, and we feel strongly enough to put the Serena name on. And so we're talking about those products tonight. 2 of the products will be our product of the month for September, so you'll get 20% off of those if you decide that you want to come in and purchase those products in the month of September. So the first product that we're talking about is a retinol. We have 3 different strengths here, and Shirley just did a beautiful presentation. We're going to ask her.
We wish you could have heard it.
We wish you could have shared it with us. We thought it sounded great, but she'll go through it again, talking about the retinols.
Great. So the Serena retinol that you have here is really amazing. I think one of the things that Janine loves the best is because there's a lot of science behind it. So, there was a study conducted against the Serena retinol versus Retin A, which is the gold standard of anti-aging. So whenever you hear that word, a lot of people say that it definitely is a foundational product to have retinol or Retin A being used if you want to reduce the appearance of fine lines, if you have some textural issues with your skin, if you have pigmentary issues. It really is something that you should always incorporate in any skincare regimen.
Also great for acne.
Oh, obviously acne, yes. Tretinoin was indicated for acne first. Tretinoin or Retin A, I might use those words interchangeably. Retin A is just the brand name. But yes, so in the study, we compared it to Retin A, and we had the similar efficacy. So you're going to get the same results that you would get with a prescription strength. And then when it came to side effects, I think one of the most, the issues that people have with Retin A is that there are a lot of side effects. So because it is only that product, that active ingredient. So Serena's retinol has retinol, and it also does have a bunch of other ingredients. So you should feel really comfortable and confident that using this retinol is going to really help with some of those concerns that you might have.
Yeah, I was never able to use retinols.
Me neither.
I have like a drawer full of retinols at home. I have prescription and then ones that I tried from other places. And they're all sitting in my drawer, collecting dust, because like anyone else, I put it on my face, I get red. It works fine for a couple of nights, even if I alternate at nights. And then I get red and irritated and kind of like the rabbit eyes, even though you're not supposed to put it up, around the eyes. Well, I do. That's not, maybe you're not supposed to, but I do, because I put it everywhere, and then I got the rabbit eyes, and then the flaking and the peeling of the skin, and and I think this is the story that a lot of people share, and then they stop it. And so this retinol, this didn't happen to me at all. And I started with the 2.5x, and then I went up to the 5x, and almost ready to start the 10x when this bottle is done.
Yes, that's
so,
great.
Yeah.
So the goal with any retinol is that you want to get to the highest strength that you can possibly use and just stick with that. The problem is those same things that you mentioned, some of the side effects. You're going to get dry, peeling, flaking, but in essence, that's a good thing because it's working. Yeah. If you don't experience that, that just means that it's still working, but you can potentially, move to a higher dose and stick with that. So I think that's one of the things that people say when I get dry, peeling, and flaking, oh, I don't want it. I say that's a good sign. Yeah. You can combat that with one of your moisturizers that you have here at Serena. And so what you would do for any retinol, for this one, you would use 3 drops on your skin, and then you would just apply it on your skin in the evening, and then you would put the moisturizer that Janine recommends over that. Yeah. The one thing that's great, and how when we did our clinical study, what you want to do is just use it. Oh, let me see that one. Is the one in the front?
Yes, no, she's just going to use the
dropper. Use the dropper. How you want to use it is if you've never used retinol before, just use it once a week. The first week in the evening, and then put your moisturizer on, and then the next week maybe use it every other evening, and then what you want to do eventually is just build to using it every evening. And so if you do get some of that dry peeling and flaking and you feel like you moved up too much, well then sort of back off. The goal is to never stop using it because it really is a foundational anti-aging product.
Yeah, and some of the questions are, what can we use it in the summer? Can I use
Yeah.
it if I'm a darker skin type? Can I use it like?
Everyone should be using it. I mean,
This is
everyone.
Chris's platform,
Right.
right? And like we just need a big cape with an R on
Yeah,
it for
I
him.
mean, retinols are my #1 for everybody because
Mhm.
it targets everything. You have to be cautious with it. So you'll see retinols everywhere, and you get them over the counter. You get prescription retinols. Physician grade retinols are really awesome, like amazing. And the reason being is that you're not going to get irritated from it if you do it the way that we tell you. What happens is that a lot of times people will be like, I'm doing fine, I'm doing fine, and then they'll use it like 3 nights in a row, and then you'll get like super dry and flaky. Some people do have a little bit more sensitive skin, so once in a blue moon for people that don't stop it, just decrease how often you do it. And like Shirley said, even if you did it like once a week, you're doing to get your cells to turn over. So in some people, I'll even have them use like the triple lipid, and you can even put that on first and then do your retinol. It's not the order in which we normally tell you, but that's going to decrease the irritation that you're going to get from the retinol. But the retinol that we have here has green tea in it. That's going to decrease the irritation that you're going to get from a retinol. So it just has a lot of amazing ingredients in it, so that your skin's going to look amazing. So,
yes, it has bakuchi oil, which is a really powerful antioxidant, and antioxidants are super important for skincare. Those help to stop free radicals. What does that mean? That means just those things in the environment that age us extrinsically. So, the sun, pollution. So it's got bakuchi oil in it. It's also got licorice root, which is really going to give you amazing skin radiance. So really, I think it's something that you can work up to. You might have sometimes some itching and redness. That's also a potential side effect. But I think that, Janine, Chris, and the crew will recommend the dosage that they feel is appropriate for you and sort of share with you how to use it.
Yeah, absolutely. So
if
that's
anyone's
what we're
going to
here.
use anything, this is the product that
If
you
you
need
can
to
only
use.
pick
Yeah.
one product, it would be this. I might fight you a little bit for a vitamin C, but
This
definitely.
is also the only retinol that I've ever been able to use
Yeah.
and not like feel like my face is peeling off or
Yeah.
something of the sorts.
Mhm.
Like I've literally gotten retinol burn.
Yeah.
So I had retinol on and then I went out into the sun.
All the things you're not supposed to do.
So don't do that.
Yeah.
And wear sunscreen if you are using retinol. That's really important. Always
Retinol's a
sunscreen.
nighttime cream,
Yes.
but then if you get up the next day, you need to put your sunscreen on. So it's
Absolutely.
not, don't use
Don't
it during the
learn
day
from my
ever.
mistakes.
Yeah, learn from Lydia's mistakes. She came in, it looked like she got
looked like
had
a
swipe, like a stripe across
was so
her.
bad.
Yeah.
So correct me if I'm wrong. So the reason why we tell people to do retinol at night is more because the sunlight deactivates the retinol. Is that or no?
No.
Okay.
It's really just because you need, proper sun protection. What is happening actually when you use retinol, your skin is actually getting thicker. So the top layer of your skin is actually building because you're generating new cells. And so what it actually is also building collagen bundles deep underneath in the dermal layer. So don't stop using retinol in the summer. Now that we're almost over with the summer, but you could use it year long. You just always want to protect your skin with.
So here we have the thickest one. That's the purple. I don't know if you can see it
That's
well.
the top layer of your skin.
That's
and then
after retinol.
That's after using it for 12 weeks, and those pink bundles on that D
Yeah, that's right.
diagram, that's your collagen that's sort of plumped up after using it. So this is what we want to do, is keep our skin healthy and use it every day.
All right, and then do we have some pictures too before we move on? Is this from the?
Mhm.
This is from the retinol, right?
Right, those are
So
from the
here's some,
study.
after 12 weeks, this is from the study, and the study was published, guys, in the Journal of Drugs and Dermatology. So it wasn't like, when we say study here, we generally don't mean like Cosmopolitan, or we generally mean like actually a real, medical journal. So those are some of the,
Pretty amazing. Come in, check it out.
some of the before and afters, and that's from the study. And they looked at pigment they looked at fine lines and wrinkles,
And texture.
and they looked at texture of the skin. So
Mhm.
those were the 3 different benchmarks that they looked at. All right, so does anyone have any questions on the retinols before we move along into C's?
No, I think you guys did a great job at explaining everything, so everyone seems pretty clear about it right now.
All right, so one of the products that I'm going to talk about is, so we've talked about other vitamin C's that we carry here. Sometimes people are they don't like the smell of some of the different C's, and so we have different C's here for those people. So if you don't like one brand and you don't like the smell of it, like for me, I became nose blind to the smell of them. I don't know, I just don't smell it anymore. But there's some people that smell it, they don't like it. So we have another C. This one's called CE plus GTP. So it's vitamin C, it's vitamin E, and it's green tea polyphenols. So those are all antioxidants. They work together in a fabulous serum, and it looks and feels. Do you want to show them, Liz? It looks and feels.
Here, Laura,
It
you
looks
wanna
here.
show? Sure. So I don't have to keep getting that.
Yeah.
Here.
Put my butt.
I would
So-
love to show.
It looks just like. It looks a lot like the retinol in terms of its like
hands.
texture and.
Ooh.
Alright, so I'm just gonna keep talking while Alright, so anyways, you can use this once or twice a day. If you're using another C, this doesn't stop you from using this one either. So I don't know, I kind of feel like you can never, again, like how you like your retinols,
Yeah.
I feel like you can never have enough C in your life,
Yeah.
but it's gonna improve your skin by making it brighter. It improves the fine lines and wrinkles, and it has all the antioxidants in it, which will help to combat the free radicals, like we talked about for the retinols. And why is this important? Because these free radicals are what's causing the skin damage and the aging process. And so if we can fight those and we can combat those, then we will age slower, or hopefully not at all. That's our goal here, is to keep you guys looking young forever.
I like to kind of think of it as like blue light. You know how everybody got into like those blue light glasses or
Right,
whatever
right,
for
blue light
computers?
protection.
I like to think like
I like
that's
that.
a C.
Yeah.
Like that's what the C does for your skin. Like
That's a
same
good-
kind
yeah,
of idea, right?
I like that.
Exactly,
Yeah.
that's
Yeah.
a nice
Everybody,
way of
yeah,
thinking of it.
yeah.
Mhm.
This one also has a vitamin E in it, which soothes and nourishes the skin and will help to boost the C. So another great product. These first 2 products that we talked about, all 3 of the retinols, all 3 of the strengths, the 2.5x, the 5x, and the 10x, will be 20% off in the month of September, as will the CE plus GTP. So those products will all be 20% off. If you need more information on them, shoot us an inquiry and we'll send you more information. And otherwise, we're happy to talk about it anytime you're in here. You'll probably want to like cover your ears by the time we're done talking about them. Alright.
Alright,
Yeah.
so I guess I'm gonna go next. So I'm gonna talk about the eye serum. So it's retinol and niacinamide eye cream, is that correct?
it's a
Okay.
cream, yeah.
So it's pretty amazeballs, as Janine would say.
That's a technical term.
So,
Love that.
so it has retinol in it, and the reason why this is kind of key for, most people say, oh, it's an eye serum, it's pretty much the same thing as a facial thing. It's not. This is not, because retinols, you really need to be careful around the eye area, and because it's just super delicate, and you can get rashy, prune eyes, and everything else. So
Striping.
So the ingredients in this are pretty amazing. There's like a million. So it has retinol. It has caffeine to help with
Fading.
thank
and-
you.
Yeah.
It has ceramides, it has peptides, it has ascorbic acid. It has arnica, and it has
Vitamin K.
vitamin K. That's
Whoa.
to help with dark
eye
circles.
Good job, Chris.
Puffiness.
So yeah. And
HA.
and hyaluronic acid to
I
help
mean,
pump up your
oh my
skin.
god,
and
all the
smooth
best
area.
things in one place.
Yeah, so literally, I mean, the ingredients in this are compact, and like the texture of it is pretty amazing as well. You can use it one or 2 times a day. It's really your preference. It is on the thicker side, so some people prefer it at nighttime. And it's not like a retinol where we say you need to like slowly introduce it. I believe you can just do it once at night or twice a day right away, I believe.
Yeah.
Yes.
And yeah.
It covers what, like, it covers dark circles, under eye bags,
Yeah.
right?
It tightens,
wrinkles.
it brightens, yeah.
If you have puffiness.
Tell them
under
what
the
it
eyes.
treats, Chris.
You know, it's,
All
like the
of
people,
above.
I mean, so under eye circles are,
Yeah.
as long as I've been in this
Everybody-
profession, is the most complicated
It's
thing
like
to
so
treat.
nice.
But this is probably the best eye cream to help
Yeah.
that.
That's awesome.
that-
Yes.
Consistency is key.
Yeah.
Right. And it does
Yeah.
just help through, like, flush through some, like lymphatic drainage, just helps to flush through that darkness. That's really difficult, like you said, to treat, but it helps lighten it, so it's really nice.
Yeah.
I had a lady yesterday and she, you know, got her second purchase of the eye cream and she absolutely loves it. So,
Yeah.
Oh, good.
so I need to get it again because
Yeah,
I
yeah.
stopped using it. So.
Oh,
You know, it's like one of those where you stop and then you like use something else. But this
And then
it's,
you're like,
it's
oh my god,
amazing.
my under eyes look good.
And honestly, I, you know, and I mean the ingredient, like I was doing the research on this again, and the ingredients are really incredible. I mean, the fact that all these are compact in one little bottle is amazing.
Yeah, it really is great.
And it lasts forever.
Yeah, it
Ever,
does last,
yeah.
well, especially if you're not using it all the time. I mean, I go through mine a little quicker than him, but I use mine once a day again because it has retinol in it. I'm usually like pretty strict about don't use your night creams during the day. This might be one I would, I don't know, that it
You
might
could
be
use it
okay to
twice a
use
day.
it twice a day. Yeah, I feel like it's just a great cream. You guys will love it. We have a tester here that you guys can always try when you come in. The other thing that I did want to say about the eye cream is I have a lot of people that come in with the dark circles under their eyes. You know, sometimes I can fix it with filler and sometimes I can't. If your skin, and this is another reason to use something with a retinol in it because the studies show that it's thickening the skin over time. If your skin gets thinner over time, then a lot of times what we're seeing is the reflection of the muscle underneath the skin. That's what is the dark circle. And so it's not really a circle from lack of sleep or anything like that. It's just a reflection of the muscle. So anything that's going to thicken that skin over time is going to improve the look of that. So again, another great reason to use it. To use that cream.
And it has green tea in it. I forgot to say that.
You forgot the green tea.
So that helps decrease inflammation
got
as well.
everything.
So yeah.
Basic.
So.
It's awesome product. All right, any questions on those before we continue on? No? My gosh, you guys are
Good.
quiet.
Sure.
All right.
All
You
right.
guys
My
are just
turn?
so
Yeah,
comprehensive. It's great.
You're up.
All right, so I'm talking about the Topix brightening pads. What's awesome about these pads are not only can you use them, you know, just to brighten your overall skin tone, they're also great for post laser or before laser. Because we can add HQ to them. Yep. And the HQ is pretty much just it gets rid of those melanocytes, or it calms them down.
Yeah, it helps
calms
to
them down.
decrease that production,
Yes, so-
overproduction.
AKA less pigment. Like,
Mhm.
I won't talk science. Less pigment, that's what it means. So it's great to use. You can use them once a day or twice a day, especially when you're using it with HQ. Janine's would tell you what's best because you can get it in different percentages. So everybody's different. But then also when you're off the HQ, it's just a great brightening pad to just maintain how amazing your skin looks after your laser treatments or before.
Yeah.
So
It's a great product for if you have uneven skin tone, or we call it mottled hyperpigmentation, or if you have melasma. So those dark spots on your skin that are really difficult to treat, you can use these pads for it. And it's got 2% kojic acid, bearberry, and arbutin. Those are like botanical brighteners. So they're really, the kojic acid does similar like the hydroquinone or the HQ that Elizabeth is talking about. So it helps stop that overproduction of of melanocytes. So that's why you have some darker spots on your skin. So it's really a wonderful product to use to really lighten and brighten. The one thing I say, if you are on that, you have to have a sunscreen on, and you have to use it because you're sort of defeating the purpose. So you could actually, in half an hour of sitting out in the sun, at a baseball game or something, you can sort of retract a whole month of treatment if you're not using sunscreen. So if there's anything foundational with that, is if you're using the brightening product pads, then you have to use a sunscreen during the day.
Yeah, I think that skincare, especially like all the things that we do here, I mean, I feel everyone's frustrations out there, myself, like just in my own care with my face, because I feel like if you lost 20 pounds, it wouldn't take you one day to gain that, 15 of it back. But if we did lasers on you, and then you used HQ, and you used your retinols, and then you went out in the sun for like 4 hours, it literally would take like that amount of time to kind of really undo a lot of the work that we did here. Maybe not all the lasers and everything, but definitely if you're, approaching your face with skincare alone, it's like a blink of an eye for it to just undo it. And especially in New England, it's like 1 minute, well, the weather people say it's going to be sunny and it's, raining out, or they tell you it's going to storm all day, or you're going to get a hurricane and you get like one wind. So you may go out and be unprepared. You may not have your sunscreen on. So I wear sunscreen every day. My husband makes fun of me. He's like, it's raining out. I'm like, I never know what's gonna happen. I don't want to be caught unprepared,
Right, but the funny thing about the sun, so people say, well, I'm just in an office all day. Well, is your office, are you by a window? So even the reflection, if you're driving in the car, or if you're in next to a window, that reflection's even stronger. And so that, you still have to wear sunscreen even if you are indoors.
Well, we looked at numbers this year. Was it 196? It was like there's 196 hours in the average American's life of just driving to and from. That's 196 hours of unprotected.
That was the picture of the guy,
the
the truck driver, and one side at the window. Oh my God, you would think he was 50 years older than he was. Like it was horrid.
Just
but
going
also
to and from.
About the pads, they do have silymarin, ascorbic acid, right, in them for to calm. I think they do.
Yeah, they have to calm the skin too. So it's a lot of antioxidants in addition to the botanical brighteners.
Okay.
So you just make sure that you're using the sunscreen with it to really help.
If you get anything out of this, put sunscreen on every morning before you
and
leave your house.
every 2 to 3 hours after that.
Well,
Alright, guys, I'm gonna show you a picture. Let me see. Is it reflecting? Oh, here we go. Here, let me get this guy out of the way. So this is the top is with retinol and with the hydroquinone, and the bottom is with retinol but no hydroquinone.
No, just the brightening pads.
Yeah, just the brightening pads alone. What are you asking me to do?
There you go, up a little bit.
Up? Okay. So those are the two controlled studies that were done on that show the before and after pictures, and those are 4 weeks apart. So this stuff is gonna take time, guys. If you wanna only use skincare, it will work, but you have to be patient. This is what the pads look like. There's 60 of them in there.
Like little Stridex.
And I use the pad, like this thing gets saturated. I use it on my face, and then I use it on my chest, and then whatever little's left, I use on my arms, and then I throw it out.
I know people love them.
So that's what, and then I'll mix it. If you do want the hydroquinone added to it, I will mix it to different percentages based on what if you have experience with the pads in the past, or what I think that your skin needs. And that's something that we'll discuss when you come in.
That's the kind of cool part about the pads, is that we actually mix them here in the office. So
it's like a pharmacy.
It's fun though. A lot of times Liz has to remind me on how to do them, because it's I forget things very easily. So
I'll never forget. I was in Block Island. A little side note: I was in Block Island on vacation. I'm in the grocery store shopping around, and the office calls me and they're like, "Oh my gosh, I forget. How do we mix these?" And I'm like,
there's like multiple bottles.
There's multiple
it's pretty
bottles.
cool.
It's fun. We should do a
It's
video
very
on that.
Yeah, we'll
For
do a
their
video.
Pollyanna.
It's very customizable.
I love mixing
right?
them. Liz and I fight over who gets to mix them. I think it's so much fun.
Yeah, you get
to shake up the bottles and like put it in.
You feel like a
Like
little
mixology.
scientist. Yeah.
It's so much fun.
These are kind of my go-to for people with melasma as well.
Mhm.
One of the key things is though you really need to alternate. So you need to do, I think it's what, 3 months on, 3 months,
A
yeah, the
holiday,
holiday.
Mm.
I have so many
For
diehard
HQ.
people that have melasma that can't have such a hard time with letting it go.
Mhm.
And it's really the education part of like you really need to take a break from that HQ. So that's key. So
And
it
then during
works.
that vacation, you can just use the brightening
Yeah,
pad without the
exactly.
HQ.
Without the HQ, and it's great. It'll keep you where you're at. And the thing is like what I tell people, especially over the summer or during holidays, like our goal is to just maintain. We'll just need to maintain during that time. We don't need to, continue to. Although if you stay on the brightening pads, you'll probably continue to get improvements. But at these times, like when it's in the summer or during your kids' baseball season or soccer or whatever, if you can wear a hat and wear your sunscreen and just maintain where you're at, then it's a win. And then in the winter months, we have less to kind of clean up. But you have to live. I mean, especially with everything going on in the world and with COVID, you have to live and do the things that you enjoy. But you can do those things. There is a way to do those things and, wear your sunscreen and be safe and still look really, 10 years younger than you are. I mean, there really
A
is a way to do
compounding
it.
effect to have like really great results is if you use your pads, then you use your vitamin C,
And then,
and then in the evening you use your retinol. Those things all, will work synergistically.
Trifecta.
Yeah, that's a great way of looking at it, the trifecta. Because one product's not going to, make all these amazing changes, but, a combination of them will just really just enhance your results.
Yeah. Any questions? No questions.
You guys are so comprehensive.
My goodness.
Yeah.
Listen,
All right.
20% off in September.
Yeah.
The vitamin C and the retinol, so that's
Right.
amazing.
Yeah.
So,
Really great.
Yeah.
um,
I need you guys to let me know other things like I kind of lean towards the skincare stuff because I feel like everyone is interested in that. But if there's other things you want me to talk about, you want us to do Instagram lives on, we're happy to do it. I'm definitely going to do one on Moxie and BBL. That will be on September 9th, I believe. That one's already planned. And I know that Laura is planning a cool sculpting one as well. So we'll definitely be bringing that to you in the upcoming months. But if there's other things that you want to talk about, then that you're interested in, please let me know because I'll make it happen for you.
And the cool sculpting one, if you haven't seen cool sculpting, it's definitely gonna be great. I mean, I don't know how many people are educated on it, but it's super cool,
Yeah.
super fun to learn
Uh-huh.
about. Get it? All puns intended.
Yeah.
And
Yeah, we'll do that
Laura's
sometime.
so educated about it. It'll be a great
Yeah, we'll do that sometime in September. It'll be
Yeah.
great.
for sure.
All right, so our last thing is the body cream that we wanted to talk about.
Ooh.
You wanna do
I
that?
will
You
talk
wanna-
about it.
let me
Let me come on in.
Oh.
Can
Sit
you
in my
see
seat.
me?
No, she's good.
Yeah, I'll go right up in there so you can see my sparkle, maybe. So this is our Serena Green Tea Antioxidant Moisturizing Lotion. You're going to be surprised it has green tea in it. It has caffeine in it and other great antioxidants. What I like about this, it's silky feeling, so it's oil free. It's not greasy. Everyone in our office uses it daily, so it is good for all skin types. You can use it daily. You can use it all over your body, obviously on your hands. I also gifted this to my daughter's teachers, and they absolutely raved about it. And now this is a toddler class where they're washing their hands every 2 minutes. So that was awesome to hear that review as well. And also Lexis in the office uses it all the time. She says that it repaired her hands from all the dryness from washing them all the time, and it also helps keep it hydrated as well. So this is a no-brainer. So I hope you guys get it.
Yeah.
Yes.
Yeah, we love that cream. It has hyaluronic acid in it. It's got green tea, as Laura said. It also has some caffeine in it, so it's got some tightening properties. It really hydrates. It's great on any part of the body. I have used it on my face on occasion when
Yeah, you can
I have used it on my face. I mean,
Yes.
if I've been stuck someplace without anything, for
Yeah.
doing the other
absolutely.
stuff, That I always have in the car. I have that and a huge sunscreen in my car at all times. And so in a jam, it's totally safe to put on your face.
I use that stuff on my
pretty-
legs, like it's going on.
Yeah.
Alexis
Yeah.
says, I'm obsessed.
Oh.
Yeah.
Yeah, we're gonna pair that with our body treatments for the laser too. Like that will come with if you sign up for a body treatment, that will come complimentary with the body treatment. And then we have some other creams if you for body that you can also purchase at a discount with a body treatment if that's something that if we think that you need it. That'll be a discussion between us always, between the provider and the patient to see what is going to be the best topical for their body and for their concerns. Always, we won't just sell you something.
Winter and fall is the time to work on your body for next summer.
Yeah.
That's true. Summer bodies are
Sure.
made in winter. That's right.
And then you can get rid of your little gobbler
Yeah,
before
yeah.
Thanksgiving.
I know. There's still hope.
All right, any other questions before we wrap this up?
No.
No?
Quiet.
All right, so what are we going to give away?
Oh.
We always give away something. What are we going to give away and how are we going to do
Yeah.
it? I leave this up to Liz.
How do we want to do it?
What did we do last time? It seemed to work out okay, right?
Yeah, so we'll share the live on Instagram TV.
Mm-hmm.
If you comment your favorite products that we discussed tonight and like the post, I think that's what we did, right? They commented and liked it. Then we can give away
That product. We'll give away that product.
We'll give away the products of your choice.
Yep.
That is generous.
Yeah, you have to
That is
say what the
generous. That
product
is
is.
very
You have to
generous.
like the
One product.
post. Yeah, one of them. So you have to like the post. You have to say which product it was that you liked, and
Then
they
we'll
can't share anything like that on IG, right?
they can comment. Oh,
Okay.
they can't share, so they can comment and they can like.
Okay.
And
Now-
tag
And if
two
you tag a
people.
friend,
Yeah.
and if you tag a friend,
Yeah.
we'll
Yeah.
put you in twice. How about that?
Yeah.
Ooh.
Okay, yeah.
Raising the stakes.
Yeah, so well,
right.
actually, as many times as you tag people, I don't care. Why is there a limit? Why is there a
Okay.
ceiling?
All right.
I love
There's
All right,
no
I don't
limit.
want a
All right.
ceiling.
Tag as many people
Yeah,
as you
tag
want
as
and
many
get your
people
free
as you
products.
Here's the other thing I just want to mention. A lot of you that watch the Instagram lives are already people embedded in our practice. Those of you that are not, if you are a winner, I will need to meet you because I can't put something on your face that isn't good for your face. So even if like say you said, I don't know, the retinol is like the one that you're interested in, but then I look at you and I'm like, maybe we shouldn't start with a retinol or whatever. So this isn't like a scam. You're still gonna get your free product. I mean, the worst case scenario is I might say, hey, listen, that's not the best product for you. Let's try something else. And I'll give you that one. It's not gonna be an issue. But my biggest priority is to take really good care of our community, and the rest of the providers here feel the same way. So we have had some winners in the past that just weren't already members of our Serena community here, and so that's just the way that we've done it. So just don't be surprised if you win and we're like, oh yeah, we want to schedule you for an appointment. It could be a 15-minute thing, guys. It's not that I'm gonna try and talk you into a bunch of other stuff. It's just that I want to make sure that
Yeah.
even the best products out there could be the worst product for you if it's not the right product for you.
They are medical
Yeah.
grade
Yeah.
for a reason.
And I think that's
And
what
this is
sets
Lumetic.
us apart is that we individualize everything for people too. We
Yeah.
are only going to suggest or recommend a product or a treatment that's good for them.
Yeah.
So
Yeah.
I think that's what we do well.
All right, guys. Thanks for joining us on
Thanks.
this busy
Thanks,
Thursday
guys.
night. We'll see you
Stay
next
cool.
time. Bye. Take care.
Bye.
Did it stop?
No.